Hey, this is Dr. Green with Momenta Chiropractic, and today we're going to talk about the chin tuck or the chin retraction exercise. We use this for a lot of different reasons, primarily neck pain, but it is a super helpful exercise, especially to see if we can kind of get activation of the deep neck flexors, take some pressure off of the upper neck, and it can help with a wide variety of conditions, including cervical disc herniations, general postural kind of neck pain, and also teach good position when it comes to keeping the neck in neutral when you're doing a specific activity. So a wide range of relevancy for a lot of different conditions. So yeah, let's get into it. So the chin tuck itself is one of the exercises that I see performed wrong almost all the time, and I think it comes down to how it's cued. So it's a very, very simple exercise, but in order to do it properly, we need to feel it in the right place. So the chin tuck is not necessarily looking down, right? It's more pulling the chin back and using the deep neck flexor muscles in order to do that, or adding a little bit of overpressure so that it happens passively. There's two different versions to this. So assuming that we're doing it passively, I'll show you from the side here. All we're looking to do is add a little bit of pressure. You can put pressure directly on the chin or kind of along the arch just over the mouth there. And what we're doing is we're seeing if we can kind of let our neck relax and push back, almost as if we're trying to kind of straighten the neck or lift the top of the head and kind of get that chin to move straight back rather than chin down and flexing the top of the head. So you'll know if you're doing it correctly if when we push back, it feels like the neck straightens and we feel like a little bit of almost like a stretch or release towards the top and a little bit of kind of like pressure through. But if we feel those muscles in the back as we do it, they should stay completely relaxed, as in we shouldn't be using the extensor muscles on the back side of the neck. When we do it actively, it's very similar in terms of emotion, but rather than pushing to passively push my head back, I'm just pulling my chin back using the deep neck flexors, where I should feel it deep here and not necessarily using the extensors to pull my head back that way. So if you can see the difference, it's a retraction and not a tuck or extending my head back to get there. If that's difficult, sometimes we can even just start in a lying position. So in order to do this, we typically like to have a little bit of flexion or like a pillow resting underneath just to put the head in a comfortable position so that you're not too far extended back. If we're doing it passively, we can just add a little bit of pressure straight down and should feel a little bit of a stretch on the back side of the neck. If we're doing it actively, we're going to do the same thing. We're just going to pull chin back, almost straight down, making sure not to push with the top of our head and get those muscles on the back firing. Those stay completely relaxed. Just pulling back and should feel those muscles start to contract underneath the chin on the front side of the neck, okay? Sometimes in these cases, we'll also add a little bit of what we call cervical rotation, which just means kind of rotation side to side. In order for this to be successful, we have to be able to maintain a little bit of that chin tuck position and then rotate kind of like on that axis. What I mean by that is sometimes what we see is with rotation, rather than being able to stay back and rotate here, we see people rotate by bringing their head out and forward, which tends to crank on the muscles on the back side of the neck and irritate the neck a little bit if they do have pain there. So we want to be able to tuck the chin back, keep a little bit of activation in those muscles, and see if we can keep our head in the same position but rotate side to side, as in not allowing the head to come forward or extend back as we start to rotate. So chin tuck and then rotate side to side. If it's difficult to do in a seated position with gravity, we can do the same thing laying down. So similar position. We're going to lay on our back, a little bit of a chin tuck, and then just rotate, maintaining a little bit of that tension on the front side of the neck, and it should feel okay in terms of any sort of pain or discomfort in the back of the neck, as long as we're doing it properly. So that's a breakdown of the chin retraction, both passive and active, as well as an introduction to how to kind of start to do a little bit of rotation and get some movement back in the neck. Again, very simple exercise, but commonly done incorrectly because we don't want to start to use the muscles on the back side of the neck to compensate. We want to either get passive motion or use those deep neck flexor muscles to achieve that movement. So I hope that helps to clear up some stuff for you if you're not feeling in the right place. If you have any questions, as always, just let us know.